Imagine feeling like you've worked out really hard, but you haven't even moved. Your muscles ache all over, you're exhausted, and you just can't seem to shake the feeling. That's what life can be like for someone with fibromyalgia. This condition is like a puzzle, causing widespread pain and a whole bunch of other symptoms that can make life really tough. Fibromyalgia is a chronic condition. This means it lasts for a long time, often for years. It's also important to remember that everyone experiences fibromyalgia differently. Some people have mild symptoms, while others have more severe symptoms that make daily tasks a real challenge. There's no single test to diagnose fibromyalgia. Doctors often have to rule out other conditions first. This is because the symptoms can be similar to other health problems. Diagnosing fibromyalgia can sometimes feel like a long and confusing process. The good news is that even though there's no cure for fibromyalgia, there are ways to manage it. With the right treatment plan, people with fibromyalgia can find relief from their symptoms and live full and active lives. One of the trickiest things about fibromyalgia is that it can feel different for everyone. This variability can make it incredibly challenging to diagnose and treat effectively. Each person's experience with fibromyalgia is unique, with symptoms that can fluctuate in intensity and location. It's like a chameleon, changing its appearance and making it hard to pin down. Just when you think you understand it, the symptoms can shift, presenting new challenges and making it difficult to manage. But one thing's for sure, pain is a constant companion for people with this condition. This pain can be relentless, affecting daily activities and overall quality of life. Imagine your body as a giant alarm system. Normally, this system alerts you to injury or danger, but with fibromyalgia, it's like the alarm is stuck in the on position. With fibromyalgia, this system gets super sensitive, sending pain signals even when there's no injury or danger. This heightened sensitivity can make even the slightest touch or movement feel excruciating. This widespread pain is often described as a deep, aching and burning sensation that can affect muscles, joints, and even the skin. It's not localized to one area, making it even more challenging to treat. It's like having a really bad case of the flu, but it just never seems to go away. This persistent discomfort can be both physically and mentally draining. But fibromyalgia isn't just about physical pain. The emotional toll can be just as significant, leading to feelings of frustration, anxiety, and depression. It can also mess with your sleep, leaving you feeling exhausted even after a full night's rest. Sleep disturbances are common, with many people experiencing insomnia or restless sleep. This fatigue can be so intense that it makes it hard to concentrate, remember things, or even hold a conversation. This cognitive impairment is often referred to as fibrofog. It's like your brain is running on fumes, no matter how much you try to refuel. This constant state of mental exhaustion can make everyday tasks feel overwhelming. And as if pain and fatigue weren't enough, fibromyalgia often comes with a whole bunch of other unwelcome guests. Headaches, irritable bowel syndrome, restless leg syndrome, and even increased sensitivity to light, sounds, and temperatures can all be part of the fibromyalgia experience. These additional symptoms can further complicate the condition, making it even more challenging to manage and live with on a daily basis. Managing fibromyalgia often requires a multifaceted approach, including medication, physical therapy, and lifestyle changes. Self-care practices such as gentle exercise, stress management, and a balanced diet can also play a crucial role in alleviating symptoms. Support from family, friends, and support groups can make a significant difference, providing emotional comfort and practical advice. Connecting with others who understand what you're going through can be incredibly validating and empowering. It's important to work closely with healthcare professionals to develop a personalized treatment plan. Regular check-ins and adjustments to the plan can help manage symptoms more effectively and improve quality of life. Mindfulness and relaxation techniques can also be beneficial, helping to reduce stress and improve overall well-being. Practices such as meditation, deep breathing exercises, and yoga can help calm the mind and body, making it easier to cope with the daily challenges of fibromyalgia.
Living with fibromyalgia can feel like walking through life with a backpack full of rocks. Each step is a struggle, and the weight never seems to lighten. This constant burden can make even the simplest tasks feel insurmountable. Everyday tasks that most people take for granted can become monumental challenges. Simple activities like cooking a meal, cleaning the house, or even taking a shower can feel like climbing a mountain. The energy required to complete these tasks is often more than someone with fibromyalgia can muster. The constant pain and fatigue can make it hard to work, socialize, or even just get out of bed in the morning. Imagine waking up feeling like you haven't slept at all, your body aching from head to toe. This is the reality for many people with fibromyalgia. Imagine trying to focus on your job when your body feels like it's been run over by a truck. The pain can be so distracting that it becomes nearly impossible to concentrate. This can lead to decreased productivity and increased stress, further exacerbating the symptoms. Or trying to enjoy a night out with friends when you're so exhausted you can barely keep your eyes open. Socializing can become a daunting task, and the fear of not being able to keep up can lead to isolation. The desire to be part of social activities is often overshadowed by the overwhelming fatigue. For many people with fibromyalgia, these scenarios are a daily reality. The constant battle with pain and fatigue can make it feel like life is passing by, leaving them struggling to keep up.
The unpredictable nature of fibromyalgia can also make life incredibly frustrating. One day you might feel relatively okay, and the next, you're bedridden with pain. This inconsistency makes it difficult to plan ahead or maintain a routine. Symptoms can flare up unexpectedly, making it difficult to make plans or commit to social events. The fear of having to cancel at the last minute can lead to anxiety and a reluctance to make commitments. This unpredictability can lead to feelings of isolation, anxiety, and even depression. The constant worry about when the next flare-up will occur can be mentally exhausting, adding to the physical toll of the condition. But it's important to remember that you're not alone in this journey. Support from friends, family, and support groups can make a significant difference. Sharing experiences and coping strategies can provide comfort and a sense of community. Millions of people around the world are living with fibromyalgia. This global community is a testament to the resilience and strength of those who face this condition every day. By understanding the challenges this condition presents, we can start to break down the stigma surrounding it and create a more supportive and understanding environment for those who are struggling. Education and awareness are key to fostering empathy and support for the fibromyalgia community.
Scientists and doctors are like detectives, constantly searching for clues to solve the mystery of fibromyalgia. This condition, which affects millions of people worldwide, is still shrouded in uncertainty and complexity. The journey to uncover its secrets is ongoing, with each discovery bringing us one step closer to understanding and managing it better.
While the exact cause of this complex condition remains unknown, researchers believe that it's likely a combination of genetic predisposition and environmental triggers that sets the stage for this chronic pain disorder. These triggers can vary widely, from physical trauma to emotional stress and even infections. The interplay between these factors is intricate and not yet fully understood, making fibromyalgia a particularly challenging puzzle to solve.
Imagine your genes as a blueprint for your body. This blueprint contains all the instructions needed to build and maintain your body. However, just like any blueprint, it can have variations and imperfections. Some people may inherit genes that make them more susceptible to developing fibromyalgia. These genetic variations can influence how the body processes pain and responds to stress. However, having these genes doesn't necessarily mean you'll develop the condition. It's a bit like having a predisposition for a certain trait. It increases the likelihood, but doesn't guarantee it.
It's often a combination of factors like a stressful event, a physical injury, or even an infection that can act as the trigger, flipping the switch and setting off the cascade of symptoms. These triggers can vary greatly from person to person, adding another layer of complexity to understanding fibromyalgia. Think of it like a campfire. The campfire needs both wood and a spark to ignite. The genes provide the wood, but it takes a spark to ignite the flames. This spark can be any number of environmental factors that interact with the genetic predisposition.
Researchers are still trying to understand exactly what those sparks are and how they lead to the development of fibromyalgia. They are exploring various avenues, from genetic studies to environmental factors, to piece together the puzzle. Some theories suggest that fibromyalgia may be linked to the way the brain processes pain signals. This involves complex neural pathways and neurotransmitters that can amplify pain signals. It's like the volume knob for pain is turned up too high, causing even minor sensations to be amplified into significant discomfort. This heightened sensitivity can make everyday activities challenging and painful.
Other research focuses on the role of the nervous system, the body's intricate communication network, and how it might contribute to the widespread pain and other symptoms. The nervous system's role in fibromyalgia is crucial, as it helps regulate pain and other bodily functions. Understanding fibromyalgia is not just about scientific research. It's also about listening to the experiences of those who live with it. Patient support groups and communities play a vital role in providing insights and support. Managing fibromyalgia often requires a holistic approach, combining medication, physical therapy, lifestyle changes, and psychological support. Each person's journey with fibromyalgia is unique, and treatment plans need to be tailored to individual needs. The hope is that ongoing research will eventually lead to more effective treatments and possibly even a cure. Until then, the combined efforts of scientists, doctors, and patients will continue to shed light on this enigmatic condition.
Managing fibromyalgia is like finding the right combination on a lock. There's no one-size-fits-all solution, but with the right approach, you can find ways to unlock relief and improve your quality of life.
Treatment typically involves a multi-pronged approach, combining medication, therapies, and lifestyle changes to target different aspects of the condition.
Medications can play a crucial role in easing fibromyalgia symptoms. Pain relievers, antidepressants, and anti-seizure medications are often prescribed to help manage pain, improve sleep, and reduce fatigue. These medications work by interacting with chemicals in the brain and nervous system to regulate pain perception and mood.
But medication is just one piece of the puzzle. Therapies like physical therapy, massage, and acupuncture can also provide significant relief. Physical therapy focuses on gentle exercises to improve strength, flexibility, and range of motion, while massage therapy helps to relax muscles and reduce tension.
Acupuncture, an ancient Chinese practice, involves inserting thin needles into specific points on the body to stimulate energy flow and alleviate pain.